What's up, y'all? This is Carolina Doc PT, and in today's video, we're going to be talking about what it's like to be a home health physical therapist. So I'm going to start off with a list of kind of likes and dislikes of doing this particular job. So if you like spending hours and hours in your car driving all over the place, then home health physical therapy may just be for you. Also, if you like spending hours and hours on your documentation and even sometimes into the wee hours in the morning, then home health physical therapy is potentially a job for you. If you like walking into houses where there may be bugs on the ceiling, on the furniture, there may be weird or strange smells around, there may be dogs that are wanting to take your leg off, then home health physical therapy just might be the career for you. If you enjoy walking into a person's house who you have never met before, and then you're going to treat them as a patient, and the first words you hear as you open the door are, "I hope you don't mind, I'm not wearing any pants." A true story. Then home health physical therapy might just be the job for you. Conversely, if you do not like helping patients who really need your help because they may be experiencing one of the worst time periods of their lives, and they really need you to help progress them from that, then you may not like being a home health physical therapist. If you do not like having a lot of autonomy in your the way that you practice, then home health physical therapy may not be the career for you. If you do not like being paid at a rate significantly higher, typically, than any other area within the field of physical therapy, then home health physical therapy may not be the correct career for you. And if you don't like having a significant amount of flexibility to your schedule, well, yeah, I'll stick with that. Significant amount of flexibility to your schedule, then home health physical therapy may not be the job for you. So I think home health physical therapy can be a very rewarding area within physical therapy to practice in. It is not the type of job that you're going to want to take if you have just graduated from school. Matter of fact, you won't even have to worry about it, because most organizations are not going to hire you if you do not have experience. They want to have experienced physical therapists, because when you go out and you're practicing in someone's home, you are a team of one. Yes, you do have access to your managers, you'll have access to your colleagues, your other physical therapists, or even nursing staff, or OTs, or speech therapists, whoever else is on the team that you're working on. You can reach them by phone, but at the end of the day, it's you. You may be making the call that this person needs to go to the hospital. You may be making the call about, what that person is needing in that situation. So because of that, typically home health organizations are not going to want to hire someone that doesn't have any experience. They want you to be able to think on your feet and be able to have the experience for that. So if you're a new grad, you're not likely to have that opportunity. Also, if you're a new grad, honestly, you don't want to start out in home health physical therapy, because the type of patient that you're going to see there is going to be more closer to an acute care type of patient. They're not the patients that you're going to be able to do like a ton of manual therapy. You might be able to do some, but it's not going to be like you'll see an outpatient. So your manual therapy skills could possibly suffer a little bit or never develop if you are new in physical therapy. However, if you have been a practicing physical therapist for a while and you've been an outpatient, you've been in skilled nursing or the acute care facilities, then home health physical therapy could be a great opportunity to continue progressing on. As I say, there is a lot of benefits to doing home health physical therapy that is very different than the ones that you're going to see within outpatient physical therapy or some of these other positions where you are tied to a clinic or you are tied to a hospital or patients that are actually on site. It becomes very different when you're actually going to their homes. Home health physical therapy is also the type of job where you are going to kind of not cross fields so much, but there may be moments when you're having to fill a nursing role, so to speak, and trying to maybe assess a wound, although I'll put an asterisk by that. You certainly do not have to do wound care. It will depend on your clinic. You don't even have to change a dressing necessarily. That is something that you can call in the nurses to do if it's something that's significant that you find out. That being said, surgical incisions and surgical wound care, that is something that the PTs do. You will remove Aquacel dressings, you will remove staples from knees and things like that, although that's actually becoming, at least around the I think a lot of areas are starting to change with that and stuff as far as staples, and I think a lot of surgeons are starting to kind of go in the gluing route within the last little while. So you might not, it might be just as simple as just a dressing change, but you still, because you're working in a situation where there are these other disciplines at play, you may have to help out a team member by at least talking to them about certain things, and that may cross over into kind of the nursing kind of area. You are going to be taking heart rates and blood pressures on every single patient. You will be calling physicians if they're outside of norms. You may, as I say, be making the call that you have to send that person to the ER, and so there's a lot to it. There is a lot of paperwork, I will say. The home health physical therapy, that the paperwork is no joke. Depending on the software the company that you work for, that's going to really determine how good or bad that is for you. If you have the right software, it's not that difficult. It's not that big of a deal, I would say. But you make no mistake, there's a lot of paperwork. There's a lot to that. There's a lot of calling physicians' offices, a lot of physicians' offices not calling you back, so then you have to call them again in order to get authorizations and things. So that's kind of a pain sometimes. There's a lot of variability in what you will be doing also day to day. So that's another one. That's actually a really important one because every patient is going to be very different. They may have just come out of the hospital. You might be seeing an ortho patient and then turn around and seeing another patient that's a cardiac patient, and then walking into a patient that just had an amputation and is bedbound. Those are all very, very different patients, and so you'll be working with them, or you'll be pushing your what am I trying to say? You're working on a wide range of patient types, so that's kind of pushing out your tolerance and your ability to treat that variety. So you'll have to learn and deal with a lot of patients that you may not be used to seeing in that more outpatient setting range and stuff like that. So anyway, so that's the patients also that you're going to be seeing in home health physical therapy. They're typically on that acute care side. Often when I've practiced home health physical therapy, I would often tell patients, home health, we are the bridge kind of between acute care and outpatient. So you just came out of the hospital, you had a surgery. We're going to be working to progress you in these early stages, and a big role within physical therapy, because of the nature of these types of patients, is going to be working on balance. Balance is a huge component. So you'll be doing balance tests and balance exercises and working all that for pretty much all patients that you're going to be seeing. Even some of the ortho patients, you're going to be doing all that, because it's important. Your role is, as a home health physical therapist, is to work with that patient who just came home from the acute care situation, and now you're to transition them safely, whether that is transition them onto outpatient, or maybe that's just transition them in their home so that they can operate and function safely in their environment, and then return to their prior level of function. So balance work is a huge factor, because these types of patients, you're working with patients that are more in acute stages. They're also they're patients that you are not able to work as high intensity, or you're not able to work with them at the higher intensities, I should say. They're more lower intensity type of patients that you're going to be working with, because they just can't tolerate sometimes those higher intensity things. So home health physical therapy, it is a varied a career with a lot of variability to it. All of those things I said at the beginning, yes, there are bugs, there are dogs, and there are there's smoke, and going into patients' houses that they the patient's spouse is smoking cigarettes as fast as they can light them, and so there's just haze of smoke hanging all over the place. So people live in different situations. You may go to that house and then turn around and you go to a house that's really a person that is not very high on the socioeconomic scale, and then turn right around and the very next patient you're going to see is living in a multi-million-dollar house. And so there's a lot of variability from the area that you're going to operate in. And that's actually the last thing I'm going to say about this, is that is something I do talk to patients about as well. One thing as a home health physical therapist that you have to realize, and that patients I kind of joke with them about, is that when you're a home health PT, you are always at a little bit of a disadvantage compared to, like, say, an outpatient PT or something like that. I always joke that, with home health physical therapy, PTs that are going into your house, you're always the visiting team, so to speak. You're always playing on the visitor field. And so there is always a little bit of a disadvantage that you have, because you don't have the bells and whistles. But like, you go into an outpatient setting, and those patients that are going there, they are now playing on the field. They're now the visiting team. They're playing on the home field for the physical therapist. And that's the PTs there. They have tools, they have bells and whistles and machines, and colleagues instantly right there at the the next treating bed, and that they can talk to and converse and strategize with or whatever about patients. So it's a very different situation because of that. It is very much a situation where it is a team of one, and that, if you enjoy that, then home health physical therapy may be a great career for you. If that is not so much your cup of tea, then you may need to look at another kind of area if you're interested in progressing your physical therapy career. And another area would be outpatient. That is probably the typical one that most PTs are going to go into, and so that's the video that we're going to do next. And so stick around for that, and I hope that y'all have a good one. Catch you later.